everybody. This is it. About an hour ago, I went on Facebook and I told you I was going to do this really important Facebook Live. So if you're out there, show me some hearts. Show me some hearts so we know you're out there. I can't see the hearts. Kim's on the camera. Sometimes you can see them and sometimes you can't. I can't see them. So we're going to go with the thought that you're watching and you're listening. And
got a heart.
Yeah, we got a heart. Woohoo! Okay, I am down here in, is this in Annapolis Junction? Is that where I am? Just outside of Baltimore, Maryland, about a 9-hour drive from home. And I traveled down here on Tuesday morning. We arrived here with Swagger. And I'm just going to give you a little background before I introduce very, very special guests. So, some of you may have known that at the European Open last year in July in France, Swagger was running in the rain and he got tangled up very badly in the weave poles. And on that run, he also, coming down the dog walk, he reached for the yellow, running dog walk, going very fast, reached for the yellow, his leg slipped off the dog walk, landed on the ground, and then his body came over that right leg. And he didn't limp. I would have pulled him from the rest of the competition. But what I started noticing after that event in July is many times in agility when he would turn left, it was like his right leg came out from underneath him and he landed on his shoulder. He started slowing down. So, and maybe he knocked the odd bar more. Anyway, those are the only three things. He rarely limped, and if he limped, he got up. Like one of those ones you go, is he limping? And then he'd walk out of it, and he was sound. So just some really subtle changes. And I decided this year, you know what, I wanted this looked at. And I talked to my good friend, Dr. Leslie Woodcock, and she said, well, if you're going to go anywhere, you really, there's a lot of great rehab specialists, but why don't you just go right down and go and see the Canapps. So come on in, you two. So Dr. Sherman Canapp, Dr. Debra Canapp, and we came in, and honestly, I didn't know what was going to happen. So I'm going to let you guys take away about the procedure, about what happened, and about what you saw, and we'll talk a little bit more about how this affects everybody who does agility with their dogs.
Yeah, this is hugely important, and thank you so much for this opportunity, and thank you so much for coming down, and
pleasure
to meet you. We're huge fans, and Swagger is incredible. But the history that...
You might have to speak up because I don't have the microphone on.
The history that Susan just gave is so classic to what we hear with other agility dogs, and especially border collies, and the fact that they work through it. They have high drive, high energy, and it's usually very, very subtle changes. And most of the time, you saw trying to get on how to find it.
Okay, so I can share.
Yeah, so if we go to... Sorry, guys.
Oh, technical difficulty.
People are saying...
Technology.
I know. Gotta love it.
So if we go to... There.
I could do that technology.
So they just have to scroll up. So if you can't find the Facebook, you're watching, you're finding it.
Right.
Yeah.
So,
and we can we'll repost the entire video once we're doing it as well.
Yeah.
Okay. So can you guys give me some hearts if you're still live through all of these technical difficulties? If you are, we'll carry on. If not, we'll start and reboot. So crossing my fingers, and where's your phone? And we'll just check.
I'm getting little things coming up, like people joining.
Okay, then we're still live. Okay.
Yeah, there's a like.
Okay.
All right, we're good.
We're going. We're carrying on. Okay.
All right. So
there's lots of hearts coming.
Okay,
what were you saying? Sorry about that, guys. IT issues. So very classic history. Something seems off with your dog. Maybe it's the times, maybe it's weaves, maybe it's the turn sequences, but very, very subtle things. These aren't like the classic dogs coming in, holding up the leg, or a significant head bob lameness. And that's why your history fits so perfectly. And we actually had 3 dogs today that all had your same history, and 2 of which were from Canada. So
can I just interject that 4 members of the Canadian World Team have been here in the last year, and 3 of us in the last 2 weeks, right? So sorry to you Americans that they're giving some help to us Canadians. We appreciate that.
No, we're happy to help. So what I wanted to do with everyone that's watching, whether you're live now or after the fact, is just go through with you a little bit of information on this condition, because this might be something that your dogs have as well, or someone you're working with or training with may have, and I just wanted to go through a little bit of the condition, the anatomy, treatments, and then we're going to actually look at Swagger's videos of the scope and the treatment that we did today. Swagger's doing very well. We're already awake in recovery, but you'll be amazed with the history that you just heard from Susan with what we're going to see in the video clips arthroscopically of what was really going on with Swagger's shoulder. So if that's okay.
Yeah, it really shows the pain tolerance of a border collie, right?
And that's the thing. If you look at the other little dog we just did from Canada, just finished an hour ago, that little dog was showing more of a profound limp and was protecting itself, was guarding. Border collies don't. They work through it. The leg could fall off, and they're going to continue to want a trial. So, so that's our challenge with these guys. And being an owner of a border collie is something I worry about every day. So if you can scroll in here, we'll take a peek. So this is actually what I'm going to present with you guys just briefly is actually the talk that I give internationally at conferences. So you're actually seeing the segment on shoulders of this condition that we give around the planet. And this term used to be medial shoulder instability, but it's really a medial shoulder. What I mean by that is if we go to this model, this is something where this is the outside of the shoulder, the inside of the shoulder. It's these structures in here that we'll fall back to. And they're not torn. It's not like you took a knife or a pair of scissors. They're just disrupted, inflamed, and broken down. And we'll look at videos of that. So this term instability now has really been replaced with a syndrome. In other words, there's pain associated with it. There's some dysfunction because so many of you are catching it very, very early. So classic history is usually something's not right. I'm seeing a problem with either time, speed, contacts, weaves. It's usually in one shoulder. Periodically, after it's chronic in nature, we find in 20% of cases, it can be the opposite shoulder from compensation. You may rest your dog, you may try some medications, but classically, once they go back to training or competition, you start to see the issues again. And so if we look anatomically, this is what we're talking about, the inside of the shoulder, and it's made up of various components that can become involved. The first would be this big ligament called the MGL. You have a joint capsule, and the most classic, in fact, all 3 agility dogs I did today, was this big muscle tendon unit called the subscapularis tendon. So what is it supposed to do? If we look at this model, these dogs have beautiful extension and flexion, but what happens is when we take the shoulder out to the side, that term is abduction. These structures that you can see on the picture a second ago are supposed to act like the emergency brake and prevent the shoulder from going too far. So what can happen, think about our weave sequences, think about our tight turns, especially with the new European circuits. So if you think of what they're doing to the inside of the shoulder as that leg goes out, you can imagine structurally what's happening here. So we actually go and we want to measure these angles, and normal should be around 20 to 30 degrees. So it's very easy to take this little goniometer and palpate that measurement. But what we classically see is as this syndrome occurs, the angles increase. Now, some border collies, some agility dogs are like a yoga instructor. So I'm okay if they're both 50 or 60, as long as they're both 50 or 60.
Can we just interject and say that the thing that was fascinating to me is that when you, before you put Swagger under anesthetic or anything, you just gave an evaluation but you didn't just lift his shoulder up. Because that, can you explain that?
Absolutely. Thank you so much, Susan. So what happens, a lot of therapists or surgeons or veterinarians, when they test this, they'll take the whole leg and bring it out to the side. Well, what you're doing is actually a scapular stretch. Your scapulothoracic, this attaches to your thoracic cage, and then you're just bringing all those soft tissues out. So the way you test this is to actually stabilize, you're actually going to stabilize the scapula and extend the elbow, extend the shoulder, and then bring it out to the side. So in other words, you're stabilizing the scapular spine, you're reaching into the elbow, you're putting everything in full extension, and then you're bringing it out. So if you look now, we're actually testing these structures versus just bringing the whole leg out. And that's so important because sometimes they say, oh my Lord, the angle's 90. No, it's not. You just stretched and it's like a yoga instructor. We're just very stretched. So that's where we want to start. Now, this is just an example of a video of us showing how to do that in a little patient. So we'll turn the volume up here so you guys can hear this. Or medial shoulder instability or medial shoulder syndrome. Here, once again, we're going to place the limb in full extension. So elbow extension, isolate the scapula spine. So we're going to push in on the acromion process. Elbow extension, shoulder extension, and now increased abduction. And as we go into abduction, you can clearly see this is going out much further than we'd expect, and there's quite a bit of sensitivity associated with this. So I would definitely be concerned with this particular patient that we have an MSI. What we're going to do to further assess that, we'll take our goniometer, We're going to run it down the spine of the scapula to the acromion process, press into the acromion process with the goniometer, elbow extension, shoulder extension, and start to take the limb out to abduction. And you can see there's spasm and discomfort associated with this, and this is going to give us our abduction angle. Should be normally between 20 to 30 degrees. Anything above that would be a little red flag that we could be dealing with this condition. So just a little bit on the test. So the next step is, if you suspect this is happening or going on as a condition with your particular dog, would be some diagnostics. So the most important diagnostic tool, though, as we just discussed, your hands. Okay.
And
so
swaggers were dramatically different.
The big difference. So with swagger, what we found is the normal side was about 22 degrees, comfortable. We're now a nice tight end feel. The opposite side, the affected side, continued to just flow out beyond 40, almost 50 to the upper 60 degree mark. So that was a little red flag, and there was spasm and discomfort associated with that. Next step will be diagnostics. So the first thing we'll do is a gait analysis. So here at VOSM, we have a long mat that they'll walk down, and it's a pressure platform, so we can see how much pressure are they putting on the legs, so are they lame? We can also see how far they're reaching. Classically with Border Collies, we're not seeing a head bob lameness, we're seeing a stride issue. In other words, if your shoulder's sore, you don't want to fully reach. And some owners' eyes are so good they can determine that. With this machine that we have, or the mat, we can actually measure, the computer tells us what that stride length is, and that's what we found with Swagger, was there was a significant decreased stride length in that affected limb.
And I also saw when he sat, quite often he would just sit with that leg a little forward. On the treadmill, I noticed that that leg didn't extend nearly as much. There's just those little tiny things, right? And as Dr. Canapp said, that if it was any other breed, it would be very obvious.
Vastly different finding. A Labrador Retriever, some of the others, they will show you true lameness. So the next step, you would normally take x-rays, or what we call radiographs. The problem with radiographs, it's soft tissue in nature. So your veterinarian or your sports medicine specialist will say, it looks normal to me. MRI has a hard time detecting it. So I know a few of the other cases we've done this week, they were recommended to have MRIs, but MRIs are static images versus dynamic, and I'll show you an example of that. So our go-to is musculoskeletal ultrasound. So diagnostic ultrasound is so great nowadays to be able to see these things, test them. The dogs can be just like Swagger, wide awake. They're just sitting there with the probe, and Deb will go ahead and be able to evaluate not only the affected shoulder, she compares to the opposite shoulder. Nobody would ever say, hey, we'd like to MRI your normal shoulder for a comparison to that shoulder. So the nice thing about ultrasound is you're able to do these awake, see the structures. There's a direct correlation between what we're palpating, seeing visually, and what she sees on ultrasound to say, you need to drop a scope in. And that's what happened with Swagger yesterday, is there was a clear difference between shoulders. The medial compartment was disrupted on ultrasound, and the next step was then to scope. So what we see, and this is an example, this dog had an MRI in New York City. I'm abducting the shoulder right now, and clearly there's a tear in the structure. This MRI was read out as normal, but right now what you're seeing arthroscopically is I'm stress testing the shoulder. So I'm putting it through dynamic visualization, and we can actually see where the pathology is, where under anesthesia everything's relaxed and collapses. The scopes that we're using nowadays are so teeny tiny. They're the size of like a hypodermic needle. So minimally invasively, we just did a little Sheltie. The Sheltie was only, I think, 14, 15 pounds. I mean, teeny little Sheltie. So we can scope cats, we can scope very small animals, Yorkies, and you can see the technology. These things just get very small, the size of a hypodermic
These are like
needle.
pediatrics for humans.
Exactly,
right?
exactly. So here's what I want. So we're going to break away for 1 second, and I want you all to see and visualize this is a normal dog. So this is a Border Collie, and this is what we would normally see is beautiful cartilage above. That's called the glenoid cavity, the humeral head. We're inside the shoulder joint. This is the MGL, a very important ligament of the shoulder. The labrum's above. This is your subscapularis tendon, and this is your joint capsule. It should be like a nice tight water balloon, okay? It's almost like you blew up a balloon with air or water, and you touch on it, and it's very firm. Classically, what we see in agility dogs is this. Everything's just frayed, disrupted, somewhat broken down and ratty. It's not usually torn. It's just from repetitive activity and training, they start to get dysfunction and changes in that regards.
I don't know if that's
Yeah, it might be the, there you go.
it's just the
It might be the
Might show up better on the.
So then this is now putting a dog's shoulder through abduction. Now imagine, if you would, if you guys can hear me, going through weave pulls. This is that 45-degree angle that the shoulder goes out as you're going through weaves arthroscopically. Look at the stress here that's actually applied to these structures. So that's your capsule. We're going to head up here to the MGL, And now we're going through our weaves, and there it is. Look what it's doing to those tissues. Okay, so imagine repetitively hundreds and hundreds of times.
Those
you may
tissues
see
shouldn't be
this.
feather-like.
No, we'll come back to that. So how do we treat it? If we see it's mild, on ultrasound, on palpation, and on arthroscopy or needle scope, mild, we place them in some hobbles, and we'll go through that here in a minute, and they go into a rehabilitation or physiotherapy program. If we see that they're more moderate, if you look at these tissues, they're very stretched out, like a wet paper bag or a kind of a loosey-goosey type appearance. So what we need to do is somehow tighten these tissues up. So what we do here is a technique that we've adopted from humans. It's called radiofrequency, and this is a heating probe, like a laser probe. And if you watch here in a second, it's going to get very shiny. What this is doing is it causes DNA windup or collagen contracture, and it tightens the tissues on contact. Now you have to be extremely conservative as far as the treatment for this, because if not, you can overcook it and actually make it worse. You can actually make it necrotic or make the tissues unhealthy. So there's a very, very, very fine line that we've learned from human sports medicine of how to use this technique that we've adapted to dogs. We have a publication that'll be coming out on 1,200 agility dogs that we've done this technique to that have gotten back to
1,200 just on this shoulder, this shoulder thing.
Correct.
Wow, 1,200 agility dogs, guys.
What about severe cases? This dog fell off an A-frame, everything went out, it completely tore. This is very rare. Okay, so rarely, very, very rarely that they fully tear everything in an acute injury, and then you need to do stabilization. That's less than 5% of the agility dogs we see, so very, very uncommon. Periodically, though, we'll have a border collie that will hide things from us. So this is Bayer, and I'm sure Bayer's mom is fine with us. We present this internationally, so I'm sure Bayer's mom's okay showing this. Bayer's issue was not taking tight turns, sweeping wider turns, times were down. Just very, very subtle changes, but problems mainly also with weaves. So if we look at Bayer, we thought, oh, it's just going to be stretched out. We'll take the little blue probe and tighten things up. Here's Bayer's arthroscopy. Looks like 2 hand grenades went off and 3 weed eaters were in there. Everything's disrupted, everything's frayed, the cartilage is fibrillated. This is a pretty severe case. And in fact, there wasn't really any tissue for me to run the little blue probe across. So we were in the middle of a clinical trial looking at stem cell therapy, and we said to Bayer's mom, this would be a great situation for stem cells. We took stem cells from Bayer, injected with platelet-rich plasma. 90 days later, Bayer's mom was so kind to let us do a second look arthroscopy, and what you're going to see here is beautiful tissues. Everything's healed very nicely. The cartilage is smooth. The tendon looks like it has a much better fiber pattern and is healed quite nicely. So definitely something that for the severe cases, adding in stem cells is something that we find to be very, very helpful. These are your hobbles. So these dogs actually wake up right on the operating table, and we put the hobbles on immediately to protect the shoulder, because the whole thing is that the problem with this, especially in our agility dogs, is they feel better immediately because we've gone in, we've cleaned things up, we've tightened them up, and they're ready to go, 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 and they don't realize we have to protect that shoulder. I don't mind them walking. I want to prevent extreme measures of that shoulder as things are healing, because when we take the blue probe across the tissues, yes, it tightened things up immediately, but they look tight, but they take 90 days roughly to become strong enough that we can start to do the conditioning and the re-strengthening and back to training. So although they're strong looking, they're weaker before they get stronger. So that's why they wear the hobbles, to protect those tissues. So the rehab is absolutely critical. And what we find, I'll turn this volume down, and luckily, there are some, oops, sorry, that's the image. There are some phenomenal rehab therapists around the world that we've had just the privilege of working with. And so we have a well-reported, it's been published in 2 different sources, the return to rehab, or the rehab phase 1, phase 2, phase 3 that we've created here at VOSM. So for anyone having this treated, they go home with that protocol, okay? It's not cookbook. Every patient's a little different, so you have benchmarks that you follow that set you into the next phase and so forth. Can they return? Absolutely. The goal is for these dogs to get back. It's usually 3 months of recovery with the hobbles. Then they're looking at going back to conditioning, strength training, and then eventually training. And so this was Bayer. 6 months after we injected stem cells, this was the patient you saw that looked like a hand grenade went off inside the shoulder. And simply what we did was inject stem cells with PRP. Turn the volume down for you. There you go. And so the challenge that we were running into with Bayer early on before she presented to us was turns and was also weaves. And so if you watch here in a second, we were very, very happy with how Bayer went back to performance.
And how old was Bayer when he had the procedure?
About middle age.
Okay.
About middle age. And so the challenge for us, you know, and Bayer and so many of these very subtle initial indications,
Right.
weaves, times, maybe dropped a bar. Owners are saying we seem a little stiff when we first get up. Here we go into the weaves now. So no problem with entry and the weave pattern. That's okay. All right. So now let's get to the good stuff. So I want to scroll back up here, and hopefully you guys are still with us, and hopefully this is helpful because I'm.
How much good stuff we got here. Hearts for Dr. Canapp. That's amazing stuff.
All right.
Everybody's learning. I learned so
I love it.
much.
Let's go to
And
Swagger.
Kim, who is a vet tech on the camera, she was like, "This is so cool."
So now let's go to Swagger because that's why we're here. Swagger did wonderful with the procedure. When we went in arthroscopically, again, I was surprised because the history from you, the subtle changes, palpation, I had a little red flag, ultrasound raised the flag, gait analysis raised it further. Let's look at some images. Remember, this is what we should see. Oops, sorry. This is what we should see. Beautiful ligament, beautiful tendon, that's subscap, beautiful capsule. We'll look at still images first, and then we're going to go to video. I don't know if you want to kill those lights, if it'll show up better. See if that works for you.
Yeah.
Oh yeah,
Okay.
that's good.
All right.
So what
lots
we're
of
looking
hearts.
at here, I'm going to get the pointer.
Can't really get it.
Top of the joint, lower joint. This is the subscapularis tendon. You see how it looks like feathers are all disrupted? That should be a normal looking tendon. If we come back over here again to this guy as a comparison, that letter C, that's what we should be seeing, okay?
That should be the letter C.
It should be. Huge difference. Here's another example of it. It just looks like marshmallows and mashed potatoes mixed with a lot of inflammation, as you can see up here. It's a pretty significant shoulder. Another view of it. You can't see a normal fiber pattern. This is your biceps tendon. All this soft tissue, redundant tissue, is the joint capsule, which has stretched out and is actually causing impingement and some adhesions here within the region of the biceps tendon. So for some of these dolls, then their reach pattern might be a little decreased because they have some bicep sensitivity.
And
as
he
well.
would, on his regular, he gets weekly massages, he would often have trigger points in his bicep as well.
And that would make sense. This is now coming back. So this was the anterior cranial segment. Now look, there's a little normal fiber pattern. So we have some faint areas where it's a nice shiny fish scale appearance, but we have a lot more that looks like marshmallow or you know, unhealthy tissue as you see here, but there is some hope as we head posterior. This is the normal part. So in the very most caudal aspect of the shoulder, this is the subscap. Look at that beautiful fish scale fiber pattern. That's really what we want to be able to see, okay? So now let's go to the videos. Okay, so we're gonna get out of here.
You guys are getting to see Swagger's procedure that happened this morning. I don't like to call it surgery because
No, it's minimally invasive. It's all through a keyhole. So let's just drop the
he
scope
was
in.
under anesthetic, but it wasn't like there was any big cuts with a
No,
scalpel
no.
into his shoulder.
Here we are. So we're scuba diving. This is Swagger. There's the subscap. Look how angry that is. It looks just frayed, feathers, disrupted, lots of inflammation up here in front where the capsule would be. And what you're going to see here in a second, there's some healthy tissue back there. Cartilage looked beautiful. So because Susan was so quick to see this and very, very rapid as far as getting treatment, we don't have arthritis. The cartilage looks absolutely gorgeous. There's no secondary arthritic changes because Susan caught this very, very early. Okay, so let's go through some other videos. Some of these take just a second. They're fairly large videos, so they can take a second to load. All right, there's healthy tissue. See, nice fiber pattern, beautiful. Then we work our way forward. Very angry, inflamed subscap. There's our biceps tendon. Okay, so the biceps was fine. That you could understand because of the adhesions and some of the inflammation and impingement that the biceps would have some discomfort. Okay, let's go to another. Is this showing up in there? Okay.
Yep,
All
yeah,
right.
it's showing up
All
great.
right. Here we go. So one more, there's the MGL. This is your labrum up here. The labrum looked good. There's your biceps again. That looks good. So how are we going to treat this? So the way we went about treating this was two things. The first was that little blue probe we talked about, the radio frequency treatment. So again, very conservatively taking this probe, and you're going to see here in a second when we activate it, the tissues get shiny. That's what's causing the DNA to wind up, collagen contracture or tightening on contact. So we're going to run this probe over top of the tissues, and that will basically tighten them up immediately. So let's look up here. Keep an eye. You're going to see it. It gets shiny. It gets really taut looking. And there's an example there if you guys can see that.
Yeah, it's showing up.
Hopefully at home you all can appreciate this. Again, if I went over those tissues again and again and again, we would actually cause them to be weaker. So you can't overcook these. It's a very conservative approach to doing this. And so we're just going to hit all the areas that are affected. Then what we did, and we'll turn the lights on and chat a little bit further, but we took stem cells in PRP and actually injected them then into the areas that were affected as well, because that will really take this from just helping with the dysfunction, the pain, and the abnormal tissues to really being able to get these to heal to the best of their function as far as true tissue healing. So hopefully this makes sense to everybody at home. All right, so we're going to just pause this for a second, and we'll turn the lights back on. So what we did then for Swagger is we finished doing the arthroscopy, confirmed the diagnosis, treated everything conservatively with the radiofrequency, and then we took a little needle and went into Swagger's hip. We collected a bone marrow sample. In bone marrow are stem cells. We all have them in all of our tissues. We have a machine here that is validated for dogs, that they also use in humans, that actually can separate out and pull out the stem cells. It pulls out what we call bone marrow-derived progenitor cells or stem cells. We then also collect a blood sample. We spin that down in a centrifuge that's been validated for dogs to pull out what's called PRP, which is platelet-rich plasma. The studies have all shown, what we've published is that adding stem cells to your PRP adds synergy. The stem cells are upregulated by the PRP. The PRP in itself can help with tissue healing. So those two together take it from one level of healing to a whole nother level. So what we did then is mix those together into a cocktail and injected them into the areas that were injured. Lastly, went into the hobbles. So we were just looking at these dog leg hobbles. Here's our studio dog for an example. And again, the idea is we want to have normal range of motion, but we want to prevent abduction for the next 90 days as we're going through the rehab program. And you know, anything I do arthroscopically, that's not as important. And the magical stem cells, that's important, but not as important as what you do after the treatment. The physical therapy, the rehabilitation therapy is key. And so it's so important that afterwards we now have a regimented rehab program that will follow, because I can get these tissues to heal, but the key is prevention. So how are we going to keep Swagger from having this happen again? Shoulder strengthening. Okay, so getting the tissues to heal. So first thing we do, we need a diagnosis. We got it. Next thing we do, we need a treatment. We got it. Next thing is let the tissues heal, 90 days. Then let's start to condition and treat them and strengthen so we can prevent recurrence. And that's why our success rate for this has been in the 90%, and the ability for us to be able to take these dogs back. However, what we've found is in about 20% of cases, the opposite shoulder. The reason we think that's happened is some of these are very chronic before they get to us. They've been compensating yet still competing, and they've started to then break down the opposite shoulder. So again, as quick as we can catch these, we will. We always ultrasound the other side to make sure it's okay. And if we need to treat that, we will concurrently treat both at the same time. For Swagger, just physical therapy, just rehabilitation therapy, because you caught it early enough, which is fantastic.
So in Swagger's case, it was a catastrophic event that, when he was running on the rain in France, and it was just unfortunate. It was just, people said, it was just bad luck, really. And he was well conditioned, and it just, stuff happens occasionally. But this can happen in other ways. So what can people do to avoid, if they have a young agility dog coming up, what can they do?
Yeah, so that's such an important question. So the first thing is, think about footing. Think about the surfaces that these dogs are training on or competing. We got to make sure that they're on surfaces that are really, really adapted to their grip. Because remember, as they're going through it, they're putting enough stress as it is going around the course. But if it's wet grass, if it's wet sand, dirt, conditions that are really going to allow that shoulder to splay out, that can over time contribute to this condition as well. Training too early. I really worry about these dogs being skeletally mature. I don't mind doing some puppy agility work. I think that's important.
Just body awareness and strengthening.
Correct.
But yeah, we've had this discussion earlier about not getting these, even I see baby puppies, doing multi-wraps around a cone over and over and over and over daily, like several times a day, or, getting them running full courses at 6 months with just, bars on the ground or things like that. Like, there's so much more we can do, right?
There is. And so I think the other thing is important is your warm-ups, keeping these puppies or these older dogs, even that are competing, appropriate warm-ups, appropriate cool-downs, appropriate stretching, seeing your chiro, your massage therapist, your physio, all those people, your team. These are athletes. They have their team just like a human athlete, and keeping these shoulders conditioned, cross-training is so important as well.
One other point with border collies is knowing when to stop.
Big one.
Because they'll just keep going and offering, and we're like, oh, one more time, and it's when they get tired is when they actually just maybe do a little something, see it, but that builds and builds and builds, and I think that's...
It's like that last run, we're skiing, and that last run of the day is like, we probably should have stopped. That's when things go awry. So I think that's key, but if you suspect something's up, I think what you did was so critical. Taking the next step, just to have somebody evaluate. Find someone that's boarded in sports medicine, that knows agility, that knows sports, that knows this condition, that has done not a few of these cases, thousands of these cases. And then just have them evaluate and just make sure that we're staying on top of it. What we recommend here is that once a year these sporting dogs come in and actually see them for wellness evaluations. In other words, they're coming in just for us to palpate angles, walk down the gait analysis mat, get some numbers, make sure everything's sound. Deb will throw a probe and just look at the shoulders, make sure structure looks good and anatomy looks good. Okay, clean bill of health, off you go. So we would do that ourselves.
Right.
It's important not for your general vet wellness visit, but your sports medicine wellness visit, I think, is critical for these patients to keep them through the years and keep their career happy and healthy long term.
It's just so there. There's so much, especially with border collies, that they will just keep going. And one of the things that was really critical for me, and if you don't do this, please start, is I video everything. I video I'm getting slack about my practices, but I used to video every practice, and there isn't a run Swagger has done in his career in agility I don't have on video. So what I did when I suspected his times were off, I went through everything up until where I felt he had an issue in July of last year. And I put the videos in slow motion.
That's awesome.
And I didn't see anything. And then the runs after that event, every single trial, there was at least 2 or 3 times where he would do that, try to push off on that right leg, and the right leg would come. In fast motion, all I would see is he landed and he fell on his shoulder, and so everyone said, "Oh, his left shoulder's giving out. His left, he's landing. He's landing on his left shoulder." And I thought, when you see it in slow motion, what you really see is that he relies on his right shoulder to push off, and his right shoulder goes, "See ya," and his left shoulder goes, "What the hell?"
Right.
And so it was that caused when he started doing that, he'd go, "I'm not going fast.
Right.
I'm going to slow down here." And so by videoing, I actually put together this compilation for these two to look at before I came, that I could, this isn't normal. And it only happened on turns to the left. It never, not once in 9 months since that accident in France, did it ever happen turning to the other way. So I'm like, so video your
huge.
everything that
because you can send those into us, and that's part of what we do is, especially for us to help confirm or a suspicion for an owner, a handler, or a trainer. But then after the fact, it's important for me to be able to put my eyes in the sky and see them back in training and back in competition to make sure things look okay. So video is absolutely critical. The one thing you brought up though that worries me so many times is that you saw a particular, you were at a try, there was an episode.
Right.
For so many agility dogs, there is no episode.
Right.
It's just that repetitive activity of putting that shoulder through these extreme motions, which they have to do on a course. There's just no way around it. So even if your dog hasn't had an issue where you're like, yes, he fell off the dog walk, the A-frame, going through the weaves, he got hung up, you're just suspecting otherwise that something's off, you could be right. So you could be right. So trust your judgment. You guys know your dogs.
Right.
And trust your gut, trust your judgment. And if you suspect it, start looking into it, that's for sure.
Cool. And I hope this has been useful. I told these two, I came down here kind of under the radar because it was just suspicions, and I know how many of you people love Swagger, and I didn't want to start drawing attention, but I thought this is such valuable information. I hope you guys have found it valuable. I hope you take note and you start taking into consideration the things that we've been talking about warming up. I just see so few people warming their dogs up the way they need to be.
Yes.
And then after run, throwing them in a crate, right? And so if you aren't sure what warming up means, get with a professional that can help create the warm-up program that your dog needs, right? And please, if you have young dogs, please build their bodies. So many people say to me, "Oh, my dog's growth plates are gone." Do you know I have never x-rayed for growth plates in my life? Because I don't care. I care about, does that dog physically have muscles to support those joints? So it's 16 months old before I start doing any of the things people are doing at 5 months with their dogs. So
there's a tremendous amount of work mentally with them to stage them up for that, and then it makes it easier when you start them at 16 months. You have such a basis
exactly.
to it. So.
And things like from 16 to 18 months, my dogs are accelerated. They're catching up. But the thing is, like you guys have said, at 5 months, border collies will do it.
Oh.
But we're the ones with the opposable thumbs, people. We're the ones that are the higher learners, and we have to step in for the dogs. So thank you both.
Our
Thank
pleasure.
you.
Our
I
pleasure.
really appreciate everything you've done for Swagger, and thank you for taking the time out of your schedule and sharing this with everybody today.
Our pleasure. Thank you
So
all.
hearts for the Canapps, everybody. Hearts
Everyone
out
loves
there.
it. Everyone loves it.
Okay, good. Okay,
Love the
we'll see you guys
information.
next time. Thank you.
Is that okay?